In this video, I want to show you how you can use a tourniquet blood flow restriction training to get stronger. I'm Dr. David Geyer, orthopedic surgeon, sports medicine specialist who wants to help you feel and perform your best regardless of age or injuries. In my last video, I talked a lot about blood flow restriction, some of the theories behind it, how it works, how you can create a tourniquet, what type of devices you use, how to decide the weights and the protocols and things like that. And I talked about how it's good for people that have pain, that are dealing with arthritis or overcoming an injury. And I'm going to show in another video some specific exercise programs you could do if you're recovering from an injury. But in this video, I want to talk about how you can actually get stronger. If you're a big muscle-bound guy in the gym, you can use this. If you're just somebody trying to get in better shape, this is a great way to do it. Now, again, I don't think that it's something that replaces normal workouts, but I think it's something that can supplement it. And again, we're talking very low loads. And for a lot of people that are really in shape, very light weights it's just not going to do you that much good. But as a finisher after a normal workout, or maybe to supplement a cardio routine one day, I think it can be really good. Now again, you can use the big fancy devices that physical therapy gyms have, that the tourniquet's connected to a monitor. There's a bunch of tubing and the monitor's got to be plugged in. If you have access to that, that's probably the safest way to do it because you can specifically set the pressure. If you don't have that, then there's devices you can get online. This is one from a company called Lifting Lab, and I think there's tons. There's nothing special about this. You can even use rubber elastic bands like TheraBands, and that can work really well. But you're basically going to put it in the case of your lower body, put it on your thigh. And again, as I talked about in the last video, even though you're going to put it on your thigh, there's benefits below the tourniquet for your quads and your hamstrings and your calf muscles, but also above the tourniquet for, say, like your glutes. So there's a lot of different things you can do to build strength. One of the things that you might start with would be leg press. And remember, we talked about a 20 to 40% of your 1 rep max. So if you can leg press 500 pounds, then you're going to set it at 100 pounds to 200 pounds. So much lighter weights than you would normally do. And again, there's different protocols you can do. You can do what I talked about before, the classic, which is a set of 30-second rest, then a set of 15, 30-second rest, a set of 15, 30-second rest, and then a set of 8, all while the tourniquet's up, and then you deflate it. There's other ways to do it. There's where you do 30 seconds of quick sets, and then you hold sort of the down position for 15 to 30 seconds, and then you do another 30 sets, and you basically, 30 reps I should say, and you do that till basically you hit 5 minutes. There's a lot of different protocols of how you do that. So some other lower extremity exercises you could do. You could do calf raises to build your calf strength. You could do split squats where you're basically one leg in front, one leg in back, and you basically sort of lower your body in a squat position. That can be very helpful. You could do body weight squats even, that could be helpful. You could do exercises where you're laying with your shoulders up against, say a box, that you use for box jumping. Your legs are free, and you do hip thrusts, in sort of a bridge position to work on your glutes and hip flexors and that. Again, those are above the tourniquet, but can be very effective. Again, and how you do the protocol, you may have to play around with it a little bit and figure it out in terms of the weight, in terms of the sets. Again, I like that 30, 15, 15, and 8, but it can very well work for 5 straight minutes. Or what I've seen with body weight squats is you do sets of 50. Do a set of 50, take a minute off, still wearing the tourniquet. Another set of 50, take a minute off. Another set, and basically you do 4 sets, and then the tourniquet can come off. So that's lower body. Upper body, you can do biceps and triceps at the same time or isolated. Again, 30, 15, 15, and 8. And what I like to do is you do biceps and triceps at the same time. So you put the tourniquets on, again, at about a pain level of 7 where it's tight but not where you're numb and tingling, but a little uncomfortable, maybe a fair amount uncomfortable. Do bicep curls, and you do a set of 30, then you go straight to tricep extensions. That can work really well. And then as soon as you do the set of 30 there, you go straight back into bicep curls for a set of 15. And if that 30, 15, 15, and 8 doesn't work for you, just do 30 seconds of bicep curls, 30 seconds of tricep extensions. That's 1 round, and do it for 5 rounds. There's lots of ways to do it. You can basically experiment with it, but you're going to basically have the venous blood return occluded for 5 to about 8 minutes. And I think that's where you're going to get the most benefits in terms of muscle strength and muscle growth, muscle hypertrophy. Now, if you have thoughts about this or some other exercises to suggest or just experiences with that, leave that in the comments below. Check out my next video on using blood flow restriction to deal with injuries, to recover from those, and I look forward to seeing you right there next time.